Let's talk about people who would be against this bill. We've already said people who are pro-life are not going to like it. If you're an older person, you don't want rationed health care, you don't want Medicare savaged financially.
It'd be disastrous
if you think that it's important to have innovation and new technologies, if you're a cancer person or someone else, you're going to want that new technology marching along to hopefully protect you there. And so those are people that are not going to want this whole government takeover. 40 million people that don't have health insurance, and this is supposed to help fix that problem. But you're saying 10 of those 40 at least are illegal, and the way the bill is set up, there's nothing in there that says that the illegals don't get free health insurance.
They will get free health insurance.
They will get it.
They will get it, yes. Absolutely.
Okay, so if you don't like the idea of illegal immigrants you're having to pay for their health insurance, then you wouldn't like this bill either, is that right?
Another category of folks, if you don't mind, if you'll yield just a second, and that's employees.
Okay.
If you work for a company, you shouldn't like this. And the reason for that is that mandated coverage directed by the health commissioner.
Or was it the czar? It was a commissioner.
The commissioner.
Yeah.
The health czar. The health commissioner that is going to mandate to the employee's employer what kind of care that they're given. It's going to do two things at least to the employee, and maybe even more. Number one, the employee has to accept the insurance provided by the employer. Now, of the 47 million people who are not insured today, some of those are eligible for insurance through their employer, but they just choose not to take it. But they're going to be mandated to take the insurance through their employer, and if they don't, they're going to be fined through the tax system. It's a 2% tax or fine for them not taking their employer-mandated
Well, you've got
insurance.
a new category. So in other words, let's keep this list going. If you're an employee in a company and you're currently not taking that particular insurance, you're going to be forced to do it. So you're not going to like this bill because it's going to force you to do something you didn't want to do.
That's correct. And the other thing that's going to happen to that employee, because the employer is going to be taxed or have to pay more for the plan. In fact, a lot of companies are saying already that it would be better for them to just pay the 8% tax on those employers than it is to continue to give them the insurance. So it's going to force those employees off of their private health insurance that the employer is given and force them on this so-called public option, the socialized medicine, Medicare Light or Medicaid Light, that already has huge problems, but they're going to be forced into that, and a lot of them aren't going to want to do that either.
So we already know that people who have a private plan that they like are going to lose that. So if you have a private plan you like, certainly you don't like this.
That's correct.
If you're an employee and you don't have a plan that an employer offers because you don't like it, you're going to be forced into that plan. So you're not going to go to my friend. Mr. Hoekstra.
Well, I got another category that I think may not be on your list. We shouldn't rush into messing around with their health care and with our doctors and our hospitals, and that we ought to be very deliberate, and that they would like us to know what's in a bill before we vote on it, and they would like to know what's in a bill before they call, so they can call us and tell us what they like.
Are you trying to tell me our constituents actually want us to read the bill and know what's in it before we vote on it? Now that's a novel.
I did a teletown hall meeting tonight, and there were two areas of questions all night. Number one is, where are the jobs? You know, I live in a state that has 15.2% unemployment. They've seen that we've spent $800 billion. They're saying, Pete, where are the jobs? Where are the jobs? Where are the jobs? Because of the impact that it's having on their families, on their kids, and those kinds of things. And the second category was, don't mess with my health care, or don't mess with my health care until I have an opportunity to review it and see what it's going to do to my health care. And don't vote on anything that you haven't had the opportunity to read and review and to explain to us what it will do to us.
But reclaim my time, going back to the whole premise, if you do it really fast and nobody knows what's in it, you don't have as many people that are going to say don't vote for this thing because they don't know we have to have a computer call a lot of our constituents. We can just sit and have a conversation for an hour or two. I did that last night with my constituents. You know what I heard about? Jobs. Where are the jobs? Now you want to know who's really not going to like this program here? is people that are looking for jobs. Let me connect the dots here. Where do 80% of the new jobs in America come from? They come from small business. That is 500 or less employees. 500 or less employees. That's where we make 80% of our new jobs. And who's going to pay for this mess? Guess what?
Small business.
Small business. So you take their money away so they can't invest in new buildings, new pieces of machinery, and guess what happens? They don't make the job. So if you're unemployed, you're not going to like this very well, are you? I'd like to,
well, the gentleman
yield to Congressman Brown.
Well, even if you're employed, you won't like this bill, because what's going to happen is millions of people are going to be put out of work. They're going to lose their job because of this Obamacare plan.
And the reason for that is, why are they going to lose their job?
They're going to lose their job because of the increased taxes and burden on their
So you put a whole lot more burden on the small businessman, and guess what happens? He doesn't create the jobs. In fact, you start to lose jobs.
The gentleman will,
and it's going to lose millions of jobs, and those that are working are actually going to have a lower take-home pay
because of all of the costs.
Because of the increased costs and the mandates on the individual as well as on their business. So incomes literally are going to go down if you're employed and you keep your job, but there are millions of Americans that are going to literally lose their jobs because of Obamacare.